Hi, everyone. So this is some very preliminary research and data that I'm currently working on. We haven't even finished the data analysis, but we'll just let you know what it is we're doing and sort of look at some of the trends that we've got so far. So the question was, is urinary incontinence associated with childhood obesity? And we're looking at, in children from age 5 to 18 years of age, whether with incontinence who are presenting to Dr. Caldwell's tertiary incontinence clinic, whether there's an association between weight and their BMI and incontinence and the types of incontinence. So when collecting data, there was a host of factors and conditions that was documented, and we're able to look at not only the types of incontinence, looking at their gender, how that relates, are the relationships influenced by age, obstructive sleep apnea, constipation, and a host of other things that we can hopefully look at if there's relationships or associations as we continue analyzing the data. So, first off, why is it important to look at this and think about it? Well, this is just a number of studies that were done just sort of looking at rates of incontinence, and it affects a lot of children. We know that it affects the younger age group more prevalently, so up to sort of 20% in the literature for 5-year-olds or primary kids. That's both with nocturnal enuresis, and in the study at the bottom there, that's daytime urinary incontinence as well. So 20% approximately in the primary age kids. Then as you reach adolescence and adulthood, obviously those numbers drop off. So Dr. Caldwell had done sort of a review looking at a number of studies over the years and what the prevalence was reported in different studies. And there's a range there from 20% in the 5-year-olds and up to dropping off to sort of 0.5 to 2% in adults. And then associating that with obesity, well, obesity is also becoming, it has become a significant problem in our society, and 1 in 4 children are overweight or obese. That's from the last National Health Data Survey here in Australia. It's the second highest contributor to burden disease, and we know in adult studies that BMI is an established risk factor for urinary incontinence. Just to note on that survey, in outer regional and remote areas, there's 15% more of the people are found to be overweight and obese, and that's something to think about, I guess, as we continue to analyze our data, if we're not capturing that population because we are a tertiary center, but major city, to have a think about that there's even more overweight and obese population that we're not capturing that may have incontinence. So what do we know already? Well, in adult women, there's a linear dose-response relationship between BMI and UI, urinary incontinence. And in 2010 randomized control trial, we showed the opposite, that when you lose weight, 5 to 10% in that study, that was associated with a significant improvement in incontinence for the overweight and obese adult woman. So the link, well, like many medical conditions, it's multifactorial. And we know obesity is associated with increased rates of constipation, obstructive sleep apnea, poor mobility, pressure effects in the bladder, diabetes. These are also all known to be associated with enuresis. We also know overweight and obese children have poorer response rates to treatment for both nocturnal enuresis and daytime urinary incontinence. And there's been one study now that we know in the literature published in 2013 looking at the relationship between enuresis and body weight in children. Those were the numbers. The only one that was statistically significant that Weintraub was able to report was an association in the obese category, with 30% of them having enuresis. And that was just because of numbers. It was a small study, and so that was the only one clinically significant. Statistically significant, and it was based on parent recall. So it was a questionnaire, it was a cross-sectional study done on parent recall. So luckily with our data, it was all verified by medical staff, and we have it. We've been able to do it over a number of years, so hopefully we'll have significantly higher numbers. So therefore, knowing that obesity has been proven to be a significant risk factor in urinary incontinence in adults, as well as knowing it makes the condition more difficult to treat, we thought it may be important to establish the relationship between excess weight and wetting problems to determine if targeted treatment will be effective. So what we did, we've taken from January 2004 to 2014, a look at the medical records, the standardized assessment forms that were given out and verified by medical staff at the time at the initial assessment. We collected a random sample of 1,000 of those patients over those 10 years and have been collecting the data, and I'm in the middle of analyzing and all of the data. The standardized assessment forms had a number of questions and information on it about the type of incontinence, how frequent, how severe the incontinence was, and then medical conditions associated, sleep conditions associated, age, gender, so on and so forth, constipation, dietary. So we have a lot of data that we can use to look at retrospectively, but to look at links and associations. Inclusion criteria was that age group from 5 to 18, and obviously needing to have fit the criteria for incontinence. So that is for nocturnal enuresis, having a minimum wetting frequency of 1 episode per month, and the same for daytime urinary incontinence. If the child was less than 5, then we excluded them from the study. And if they had a neurological condition affecting bladder control, a urological condition affecting bladder control, or conditions which impacted on bowel function, such as Hirschsprung's, then those patients would be excluded from the trial as well. So just looking at the data that I've actually gotten a few more since then, but when I first put this slide together, I'd looked at approximately 600 participants, approximately 50-50, 287 females, 311 males. And of those females, 72% had daytime urinary incontinence and 83% had nocturnal enuresis. Now, a number of those presented with both as well. I just haven't put that data there for you yet. But in the male population, you'll see significantly more of them presented with nocturnal enuresis versus daytime urinary incontinence. In the females versus males, there's similar numbers of how many were both overweight and obese. They fit the normal numbers for Australian data. Approximately 25 to 30% of our children are overweight or obese. Now, looking now at the weight. So for children, for females who were normal or underweight with daytime urinary incontinence, 71% of our girls had that. And if they were found to be overweight or obese, there was 75% of them had daytime urinary incontinence. The girls who were normal or underweight that I've looked at so far, there were 71% of them had nocturnal enuresis, but 81% that were overweight or obese had nocturnal enuresis. And in the males, we didn't see such differing numbers. They were actually pretty similar regardless what their weight category was. Just for your information, to calculate the BMIs, we use the International Obesity Task Force definition. So they, okay, and I'll just keep going. It's not important. You can read it in the paper later. So this study had actually been commenced a couple of years ago, and a very small data set was looked at over just a few years, and that previous analysis suggested girls had increased prevalence of DUI compared to males. This data never got published, and we thought with quite larger numbers, we'll have another look at it. Our larger sample size is showing that same trend, and also our larger sample size is showing the same trend as well with the overweight obese girls having an increased prevalence of DUI compared to the normal underweight category. The previous study did not show these associations for nocturnal enuresis in females, but we see that emerging trend, so we'll continue to look at that. And previously, there was no relation found between constipation and nocturnal enuresis or DUI. However, there have been a number of studies that have shown that association, so we intend to explore that further with our larger numbers. So basically, we need to finish data collection, do a formal statistical analysis, and have a think about what the mechanism of obesity is. We have a number of ideas, but when we get those numbers, to really think about what it means, daytime versus nighttime, females versus males, and continue from there.
Thank you.